Now we will discuss Original Medicare Part A and Part B. Most people don't pay a premium for Medicare Part A. If you or your spouse pay federal insurance contributions, taxes for at least 10 years, then you can have a premium-free Part A. However, if you do not have at least 10 years of work experience or 40 quarters, you may have to pay a premium for Medicare Part A, and that premium changes from year to year. Most people will, if you do have a penalty, you will pay that penalty, which is 10% for the rest of your life. So it's very important that you make sure that you do not miss the deadline. Under Medicare Part A, you will have hospital coverage, which includes inpatient hospital care, inpatient skilled nursing facility care, inpatient blood, home health care, and hospice care. Under that hospice care, you get your semi-private rooms, you get your meals, general nursing care, drugs that are part of your inpatient treatment, and hospital services and supplies. Medicare measures a benefit period in the hospital once you have entered the hospital or the skilled nursing facility. And it ends when you have received no more than 60 days of care in that hospital or skilled nursing facility. And you will pay a deductible for each benefit period. So there's no limit to the number of benefit periods that you can have in 1 year, and it is possible that a benefit period can span from one calendar year to the next. In 2020, for an inpatient hospital stay, you will pay a deductible for the first through 60 days. That deductible is $1,408 in 2020. If you are in the hospital beyond 60 days, from day 61 through 90, will cost you a coinsurance of $352 per day. If you are in the hospital beyond 90 days, day 91 through 150, will cost you $704 per day. That is also known as lifetime reserve days. Any days beyond 150 days, you will be responsible for, and you would make some type of payment arrangement with the hospital to pay for those costs. Most people ask, how do I pay for those deductibles and daily co-insurances? In most cases, you will purchase some type of secondary insurance, or you may have a retirement benefit that will cover those, and we will discuss that later in the presentation. Under Medicare Part A, you also get your skilled nursing facility care. That includes semi-private rooms, meals, skilled nursing care, physical therapy, medical social services, also ambulance. It's very important to understand that Medicare generally does not cover ambulance. However, it will cover it on an emergency basis. That means you are unconscious, or you need blood, or traveling any other way would endanger your health or someone else's. So it's very important that when you contact an ambulance company, that you do realize that it is a true emergency, so that the services are covered by Medicare. Now, Medicare also covers, as we stated, the skilled nursing facility, but in order for it to be covered, you must need some type of daily skilled service that does not include custodial care. That's dressing, bathing, assisting you with your daily needs. In order for Medicare to cover that skilled nursing facility, you must have 3 days of inpatient care in order for it to be covered. It's very important that if you are transferred from a hospital and you are sent to a skilled nursing facility, that your discharge paperwork says inpatient care and not observation. It is possible that you can be kept in the hospital and be there under observation, and Medicare does not cover a skilled nursing facility stay for someone who was transferred from the hospital to the skilled nursing facility under observation. It's very important that your discharge paperwork says inpatient care in order for Medicare to cover the services. Also, for a skilled nursing facility to be covered, you must be admitted to the skilled nursing facility within 30 days of leaving the hospital. And whatever you were treated for in that hospital, that condition, that is what you are being transferred to that skilled nursing facility for. And the skilled nursing facility that you are transferred to must be a Medicare participating facility. If you ever need to find out if a facility is participating with Medicare, you can go to the Medicare.gov website, and there are a list of participating facilities in your zip code. In 2020, if you are transferred to a skilled nursing facility from the hospital, for the first 20 days, Medicare will cover it at no cost to you. However, from day 21 through 100, the daily coinsurance is $176 per day. All costs beyond 100 days you would be responsible for. Medicare also covers home health care. For Medicare to cover home health care, you must meet 5 conditions. 1, you must be homebound except to attend religious ceremonies or to go to the doctor. 2, you must need some type of care on a part-time or intermediate basis. 3, you must be under the care of a doctor, and that doctor has to set up that plan of care for you. And you have to have face-to-face encounters with a doctor. The first face-to-face encounter has to happen prior to the start of the care or within 30 days. And again, that home health care provider must be participating with Medicare. Medicare and home health care, you pay nothing under original Medicare. The services are covered by Medicare. However, you are responsible for 20% for your durable medical equipment. That's going to be your wheelchairs, your walkers, your hospital care. And your plan of care will need to be reviewed every 60 days. Medicare also covers hospice. Hospice is care for individuals who have a life expectancy of less than 6 months. It provides a comfort to the family to make sure that their loved ones are cared for during the last days of their lives. And for someone to enroll in the hospice program, you must sign an electronic statement choosing hospice care instead of routine Medicare covered services. And again, they focus on making the individual comfortable and helping them to relieve pain in their last days. The doctor must certify each election period. There are 2 90-day periods and then an unlimited 60-day period. And the provider must have a face-to-face encounter with the individual. And again, that hospice provider must be Medicare approved. Under hospice benefits, you get physician nursing services, physical, occupational, speech therapy, medical equipment and supplies. You also get respite care under those services. Now, with hospice benefits, again, there is nothing for the hospice care. However, you do pay up to $5 for prescriptions to manage your pain and symptoms. Medicare Part B covers medical insurance, which includes your doctor services, your outpatient medical and surgical supplies, your lab tests, durable medical equipment, diabetic testings. Again, your doctor services are covered under Medicare Part B. Your outpatient services such as x-rays, casts, stitches, those are all covered. Durable medical equipment, that's your oxygen, your diabetic testing supplies, which you can go online to mymedicare.gov for the national programs for the diabetic services that are available. Home health care is also covered under Medicare Part B. And finally, your EKGs, your MRIs, your lab tests, that is all covered under Medicare Part B. We want to make sure that you stay healthy. So Medicare ensures that they cover preventative services for you. I'm going to point out a couple that are listed here. You are eligible for a Welcome to Medicare preventive visit. That has to be done within 12 months of you enrolling into the Medicare program. After that, you are eligible for a yearly annual wellness visit. So make sure that you check online to see which preventive services you are eligible for. There is a website called mymedicare.gov where you can go and register, and under there you can see real time your claims, the preventative services that you're eligible for. Um, you can order a new Medicare card. So it's a very good website, and I encourage everyone to take time out of your busy schedule to enroll in a mymedicare.gov account so that you can access your personal information. Now, paying for the preventative services, you pay nothing for the actual service. However, you do have to pay for the office visit. So while the test is, there's no charge, you do have to pay a visit to see the doctor. So you will be charged a copay for that doctor visit. Some services are not covered by Medicare. That's going to be dental, vision, hearing, acupuncture, hearing aids, massage therapy. So it's very important that you know what services are not covered by Medicare. For most people in 2020, you are going to have a yearly deductible for Medicare Part B. That deductible is $198. That means when you go to the doctor for the first time using your Medicare, you are going to have to meet that deductible. You will not pay $198 at one time. Basically, you will go to the doctor. If your service is $50, you will pay $50 until you reach the full amount of $198. But it is not a full $198 that you pay when you go to the doctor unless your charges do exceed the $198. The way that original Medicare is designed, it was never intended that it would be covered at 100%. Medicare pays 80% for your Medicare approved amounts, and you would be responsible for the remaining 20%. Or again, you may have some type of retirement coverage that will cover that, or it is possible that you purchase a Medicare supplement policy to cover that 20%. In 2020, most people will pay a monthly premium. Again, this amount is paid monthly. It is $144.60 per month. It is possible that some individuals, if you are single, making over $87,000 in 2018, or you were married and making more than $174,000, you will pay a higher monthly premium for Medicare, which is called the monthly income related monthly adjustment amount. That is called the IRMA. And basically, your Medicare Part B premium is based off of your income tax return from the previous 2 years. So in 2020, you will be using your adjusted gross income from 2018. So it's very important that you look at what you were paying in 2018 so that you know what your premium will be for 2020. And again, from year to year, those amounts change. So it's very important that you pay attention. Generally, Social Security will let you know sometimes in November, December, what the premium will be for the upcoming year. How do you pay for your Medicare premium? Generally, that is deducted from your monthly Social Security benefit. If you're not receiving Social Security and you're receiving railroad retirement, it will come from your railroad retirement. And for individuals who work for the federal government, it will come out of your your federal retirement benefit. However, if none of that applies to you and you are not receiving Social Security benefits, then they will bill you every 3 months. Or you can set up for Medicare Easy Pay. That can only be done through Medicare, and that can be done at 1-800-MEDICARE. And you would contact Medicare directly to sign up. There is a late enrollment penalty for Medicare Part B if someone chooses not to sign up. In most cases, individuals will sign up. However, for those of you who will continue to work after 65 and you have an employer health plan, check with your health benefits administrator to find out how it works with Medicare. But again, there is a penalty for Part B. That penalty is 10% for every 12 months that you did not sign up for coverage that you were eligible. But some people who are actively employed may delay their Medicare Part B, and those of you will not be assessed that penalty. Now, there are certain situations in which you must have Medicare Part B. That is when you are trying to purchase a Medicare supplement policy or Medigap policy. You would like to purchase a Medicare Advantage plan. If you are eligible for TRICARE for Life or CHAMP VA because you were military. If you are employed and that employer has less than 20 employees, they may require that you sign up for Medicare Part B. So make sure that you check to find out if you are required to sign up for Medicare Part B. Now you have a couple choices in how you can get your Medicare coverage. You can either go through Original Medicare and enroll in a Medicare supplement policy and choose a Medicare Part D, or you may see commercials on TV that are advertising the Medicare Advantage plans. These are pretty much your bundle plans. You get your Original Medicare combined with the prescription drug. They also give you added benefits such as vision, dental, hearing. Those may be added in those benefits. So you get to make the decision on which route you would like to take. If you decide to go under Original Medicare, that Original Medicare is health care that is provided through the federal government. It provides you your Medicare Part A and or Medicare Part B coverage. You can go to any doctor or hospital that accepts Medicare in the United States. You will pay your Medicare Part B premium, and in addition to that, you will pay the deductible and any co-insurances. Quarterly, you will get a Medicare summary notice. This is going to be similar to the explanation of benefits that you received while you were working, that basically provides you with detailed information about the services that you've received during that quarter, the name of the doctor, how much Medicare approved for those services, what Medicare paid for those services, and what your responsibility is going to be for that. So you want to make sure that you match your Medicare summary notice with your statements from the doctors to make sure that to know what your responsibility is. And with Original Medicare, you are going to want to make sure that you enroll in a prescription drug coverage so that you can get your prescription medications. Any doctor can accept Medicare, but not all doctors accept assignment. A doctor that accepts assignment has signed an agreement with Medicare, and they are required by law to submit your claims to Medicare. They will accept what Medicare pays as payment in full. They cannot charge you more for the services that you are receiving. A doctor that does not accept assignment can charge you more. However, there is a limit to what they can charge you. The limit is no more than 15% of the Medicare approved amount. And for doctors who do not accept assignment, they may charge you the full amount at the time that you receive services. Some individuals may have private contracts with doctors. A private contract is an agreement that you and your doctor have. The doctors will not furnish any services through Medicare. Original Medicare will not pay for any of those services, nor will other Medicare plans pay for those services. You'll pay for the full amount when you receive that service, and no claims can be submitted on your behalf.